Hello everybody, my name is Mariana and my systematic review it is on irritable bowel syndrome, and my research question is in adults with IBS-D, how effective are probiotics in improving global IBS symptoms? So IBS is a chronic disorder of gut-brain interaction characterized by a recurrent abdominal pain associated with changes in bowel habits such as constipation, diarrhea, or mixed patterns. It is important to know that it's not caused by a structural damage in intestines, but it's rather a result from functional disturbance involving the gut, nervous system, immune system, and microbiome. So there's two criteria to diagnose IBS. Round 3, round 4, the most recently round 4 that was updated in 2016. So if a person is diagnosed with IBS through round 4 criteria, they will have recurrent abdominal pain, on average at least 1 day per week in the last 3 months, and that it's associated with 2 or more of 3 items. 1, pain related to defecation. 2, change in stool frequency, and 3, changes in stool form, the appearance of it. Further, IBS can be subclassified in 4 types. IBS-C when the person is mostly having constipation, IBS-D when a person has mostly diarrhea, IBS-M when a person has mixed patterns, alternating them, and IBS-U when it's unsubtyped. The prevalence of IBS globally, it is known to be 10 to 20%, which is a pretty high number, and that puts IBS as one of the most occurrent gastrointestinal disease. Additionally, IBS is caused by a multifactor that involves internal and external factors that increase visceral hypersensitivity. IBS-SS, known as Symptom Severity Scale, it is a questionnaire that is used. It has 5 main components, and it is used to measure the score of a person presenting signs and symptoms of IBS related. So the 5 components are severity of abdominal pain, frequency of abdominal pain, severity of abdominal distension or bloating, dissatisfaction with bowel movements, interference with daily life, or quality of life. Once the person has answered, then with the score, we can classify either if they do not have IBS, when it's they score under 75, they either can be classified further into mild IBS, moderate, or severe if they have above 300. So this scale, it's very useful to test the effectiveness of treatment. So a person would do this questionnaire before treatment, receiving treatment, and then after the treatment they would redo it and see if they have any change in the scores. And if the change is above 50, it means that it is a significant change and a significant improvement into the symptoms. All right, moving forward, we have pathophysiology of IBS. As I mentioned before, it is a multifactor disease, which means that it does not have a single cause, but rather a multifactors that influence in the development or worsening of IBS. One of the core features is visceral hypersensitivity, meaning that the nerves in the gastrointestinal tract become overly sensitive. So even novel process like gas or bowel movements can be perceived as painful for the person. Another major component is altered gastrointestinal motility. When you have a decrease of motility, a person has constipation, and when increase in motility, person might present diarrhea. A key system involved in this change is the gut-brain axis. In IBS, communication between the central nervous system and enteric nervous system becomes dysregulated. So stress, emotional states, and autonomic responses can amplify the gut symptoms through this pathway. The immune system also plays an important role. Many patients show signs of low-grade inflammation, so you have an increase in pro-inflammatory cytokines such as IL-10, TNF-alpha, which also contributes further to pain, sensitivity, and motility. We also see serotonin dysregulation, and that it's critical because the GI tract produces about 95% of body serotonin, and you have alteration in the serotonin receptors as well, which is the HTR3A, the 3B, and the HTR4, and they affect both bowel movement, and pain perception. Additionally, you have intestinal barrier dysregulation, where sometimes we refer as the leaky gut, and that allows antigens to penetrate the mucosa, stimulate immune responses, and that worsens inflammation and sensitivity because you have an increase in pro-inflammatory cytokines. Finally, the gut microbiome, it's a major contributor as well. So you have dysbiosis when you have like more harmful than good bacteria, and this imbalance in the gut affects its fermentation, gas production, short-chain fatty acids, and the communication with immune and neural pathways. So altogether, these mechanisms interact to create symptoms we see in IBS, and these symptoms mostly includes pain, bloating, constipation, diarrhea, and overall there is an impair in the quality of life of the person as well. All right, so once a person is diagnosed with IBS, it's recommended for them to follow a low FODMAP diet, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Rich food, they are like short-chain carbohydrates that sometimes are poorly absorbed in the intestine. And then also increase visceral hypersensitivity. So this is an eliminatory diet that should be followed for about 6 weeks. So after the 6-week period that you avoid these foods mentioned here in the picture, a person slowly start reintroduce foods, and as they accept it or they have an increase in the symptoms, a person eliminates that item from the diet or are okay to have it, certain foods on their diet. So in addition to an eliminatory diet through the FODMAP diet, there is research in a lot of RCTs that have shown a positive influence of probiotics in alleviating IBS symptoms. Also influence gut inflammation, modulate visceral hypersensitivity, straining the intestinal epithelial barrier, decrease gut barrier permeability, lowering intestinal inflammation, and relief from IBS symptoms through the IBS-SS questionnaire, as I mentioned before. So concluding from everything I have mentioned previously, the aim of the systematic review, it is to evaluate the effectiveness of probiotic supplementation in alleviating gastrointestinal symptoms measured by IBS-SS scale in adults diagnosed with diarrhea, predominant irritable bowel syndrome. The research question guiding the review is, in adults with IBS-D, how effective are probiotics in improving global IBS symptoms?